Yeah.
Alright, so I'm Chris, this is Kimberly, JeeJue, and Jew, and then our presentation is about autism. So before we start, does anybody know anyone or that has autism? You do? Alright. So for you, how is it like? Do you know, like, you know someone, right?
Yeah.
So how is it like?
Like their behavior.
Yeah.
He doesn't really talk much. Like he doesn't know how to pronounce words.
That's the same with my cousin too. So April is Autism Awareness Month, so that's coming up. That's Saturday, I believe. So look out for that. And here are the facts. 1% of the world population has autism spectrum disorder. That's more than 3.5 million people living with autism every day. And the prevalence of autism in the US has increased by 119.4% from 2000 to 2010. And it's currently the fastest growing developmental disability. Autism services cost US citizens around $236 to $262 billion annually. And it costs more than $8,600 extra per year to educate a student with autism compared to just regular students like us who cost about $12,000.
So what is it? Autism is a serious developmental disorder that impairs the ability to communicate and interact with others. More than 200 cases are recorded each year in the US. Boys are nearly 5 times more likely than girls to have autism. So 1 in 68 children have autism, and 1 in 42 boys are born with autism. And then symptoms for people who have autism. So behaviorally, they have inappropriate social interactions, poor eye contact, compulsive behavior, impulsivity, repetitive movements, and in many cases they do inflict self-harm on themselves, or persistent repetition of words or actions. Developmentally, they have a learning disability or speech delay in the child, so they'll just learn how to speak at a slower rate. Cognitively, they have intense interest in limited number of things or problem paying attention, so short attention span. Psychologically, they are unaware of others' emotions or have depression themselves. And what's very common in people who have autism is that they have anxiety, they have changes in voice, extremely sensitive to sound or tick. And then treatments for autism, early recognition as well as behavioral, educational, and family therapies may reduce symptoms and support developmental or learning. Therapies they could go through are anger management, family therapy, applied behavior analysis, behavior therapy, sensory processing, animal-assisted therapy, and telepractice. And then specialists that would see them are speech therapists, occupational therapists, clinical psychologists, neurologists, psychiatrists, pediatrician, and primary care provider. And then medications to help reduce symptoms for a while would be antipsychotics, which prescription is needed. And then there are no cure for autism.
And then autism diagnosis not only changes the life of the child diagnosed, but also that of the family members. Parents of an autistic child have to bear a lot of stress due to complicated therapy schedules, home treatment, job responsibilities, and family commitments. There is also financial stress because of expensive therapies and treatments. Emotional impact on parents. Parents with autistic child are sometimes embarrassed over the child's behavior in public, and they feel socially isolated. Also, frustration at the difference between the parenting experience they are having and the one they had envisioned, and guilt from thinking that they may be responsible for their child's challenges.
So like JeeJue said, it also affects family. So studies state that parents of autistic children have a 9.7% chance of getting divorced. Parents often accept their child's autism diagnosis at different times and in different ways, which causes a conflict. Spending time together becomes difficult because of the numerous commitments and inconsistent schedules It's often challenging to find child care for autistic children.
For financial impact.
Yeah. Families with autistic children often face a huge financial burden. Expenses or autism treatment and therapies are not covered by most private health insurance. They are quite expensive, and the co-pay parents incur for medications and office visits often lead to massive financial debt. According to study featured in Pediatrics, families with autistic child underweight an average loss of 14% in their entire family income. Working full-time becomes very tough for both parents.
That's the. Alright, so does anyone have any questions? Okay.
What was
Thank
that
you.
animal assisted therapy? Was that like working with animals?
Oh yeah, so like animal assisted therapy